Social media has become an essential but also addictive part of our everyday lives. The U.S. Surgeon General has been raising a red flag about its effect on kids' mental health, and just this month called for warning labels on social media sites. Days after that, Governor Hochul made New York State the first in the nation to require social media sites to restrict addictive feeds and prohibit sites from collecting, using, or selling personal data of anyone under 18. Dr. Nidhi Kumar is on call to tell us more about the science behind these initiatives and the benefit for your children. Good morning, doctor.
Good morning.
Now, when we say restriction of social media, what exactly are we talking about?
Well, first, the Surgeon General is asking for Surgeon General's warning labels, similar to the labels that we see on cigarettes and alcohol, but this label is going to alert users that social media puts you at risk for harm and harm to your mental health. And then late last week, Governor Hochul put forth some landmark legislation. She signed in the Safe for Kids Act, and the Safe for Kids Act is going to limit content for users under the age of 18, prohibit sharing information and data about these users that are under the age of 18. Additionally, she recognized that these algorithmic feeds are addictive. Now, what is an algorithmic feed? That is the system that social media platforms use actually to hook young users. What they do is they look at a user's previous searches, what information is stored on their device, and they keep sending information to get users to watch more. Now, super important here. If a company is found in violation of any of these requests, there will be a fine of $5,000 per user, and they have 30 days to correct the behavior.
So what were the findings of the studies that looked into the impact of social media on your mental health?
I mean, they are not subtle. So social media use of more than 3 hours a day, and let me just say that young people on average are using about 4.8 hours a day. Using more than 3 hours a day doubles your risk of anxiety and depression. And additionally, there's the issue of body dysmorphia. Young people that use social media report feeling, not feeling good about their bodies, these effects are not subtle.
So beyond mental health issues, there are also medical risks associated with social media use. So what are those?
Absolutely. And we don't talk about this enough. Eye strain, neck strain because of the posture, chronic headaches. We're seeing more and more young people with headaches. And then there's the inactivity. If a young person is on their device for 4.8 hours, they're not riding their bike, they're not running around with their friends, they're not climbing trees. And we know that inactivity affects mental health and affects physical health. That's why we have an epidemic of childhood obesity as well as diabetes. Now, really interestingly, there was a study out of the University of Buffalo that looked at, well, what is the stress response further doing to you internally? And they found an elevation of a marker in people that were using excess social media called C-reactive protein. That's a marker of inflammation in your body. And the thought is that overall social media use is a stressor on the body, just like other substances like alcohol and like smoking cigarettes.
Wow, Dr. Nidhi Kumar, thank you so much for all this important advice. Really appreciate it.
Thank you.